Good day. Thank you all for joining our webinar, No Cost Healthcare Provider Disability Training Opportunities. Our speaker today is Sydney Smith, Research Coordinator with the Center for Leadership and Disability from Georgia State University.
Thank you. Hi, my name is Sydney Smith. I am the program manager for the Disability and Health Program, Statewide Georgia Disability and Health Program. We are situated at the Center for Leadership and Disability. And I will share a little bit more in a few minutes about what the Disability and Health Program is. But today I'm here to talk to you about our responsive practice training, which is a disability competent care and accessible communication online training for medical professionals and all supporting healthcare professionals. Today, you'll learn about what the Georgia Statewide Disability and Health Program is, why there's a need for a disability and health program, what the responsive practice 2 trainings kind of go over, what those learning objectives are, and then what you receive in return of those, and then kind of what's next. So the Georgia Statewide Disability and Health Program, we have an overall goal to understand and address statewide public health district needs related to reducing health disparities among adults with IDD and ML in Georgia. So IDD is intellectual and developmental disabilities, and ML is motor limitations. We have been funded by CDC for a 5-year cooperative agreement funding cycle. Our program began in August of 2021, and that is a typo. We will be funded through July of 2026, not 2016. Us, along with 9 other states, have been funded to do this work and work together to close the gaps in needs and find those resources that these individuals in the communities need. There are 6 different strategies being carried out throughout this entire program to reach the overall end goal. And the best way to describe each of these strategies is essentially 6 different mini projects within this larger overall program. So the 6 strategies, the first is to establish and expand partnerships. We began, when we initially got the funding, at the beginning with the partnerships that we had at the Center for Leadership and Disability, and built out from there. Everything from local, state, and then our national partners such as Special Olympics and NCPAD, which is the National Center for Health Inclusion. And then from there, we have stakeholders on a project advisory work group, which is kind of our go-to group of decision-making throughout the program. They are really the people that are the boots on the ground in the community. We as the project and program team only know so much and only know so many people. So our stakeholders in that group are really valuable. They bring some great expertise to the table and help us make some really valuable decisions in terms of the progress of the program. The second strategy is to conduct a statewide needs assessment. So we did an entire statewide needs assessment in year 1, where we looked at local health department and district level health department data and determined some areas of need and also content-wise areas of need. So what we pulled out was a huge need for dental access and what that looks like, which is what we have done over last year and will be continuing to do this year. And then we also recognized there was a pretty big gap in access for mental health care resources. So those are plans for years 4 and 5, what we'll be doing on those needs assessments. And in turn, with the collected data of those needs assessments, we will develop resource guides and other resources that are related to those findings to help close those gaps. The third strategy, which is the primary reason I'm here today, is to educate healthcare providers and professionals on disability competent care and accessible communication. So as a 10-state collaborative, we worked together to determine if there was a training that we wanted to all disseminate and or did we want to build our own? We chose to use an existing training and enhance it and work together as a 10-state collaborative to make it meet the needs that we felt were where necessary. So all 10 states are disseminating this exact same training. It is the responsive practice. The 2 modules, the first one is the care and screening, and the second one is the accessible communication. And then our 4th strategy is our linkage program, which is essentially the best way to describe that is a closed loop referral. This strategy in particular is targeted for adults with intellectual and developmental disabilities, not our adults with motor limitations. The adult is recruited or referred to us. Our linkage coordinator goes through a screening assessment, essentially asking questions such as healthcare behavior knowledge, when was the last time they went to a primary care provider, a dentist, depending on their age and sex, some more targeted questions on what would be appropriate care for those populations. And then from there, we are able to determine any areas of unmet health needs. And then the overall goal of the linkage is to connect those adults with accessible providers as close to their community as possible to meet their unmet health need. So as an example, if we have Billy, who is in South Georgia and hasn't seen a dentist in 6 years, that would be a unmet health need. And we would work with Billy to find a provider who, in deeming a provider as accessible, is quite complex, because what is accessible to me may not be accessible to you. But we do not refer participants to places that we have not spoken with or we know has some exposure to disability competent care training. So any provider who takes our responsive practice training is considered an accessible provider in terms of that they have had exposure to disability competent care training and education. From there, our participant in the linkage program is linked. We give them 3 months to achieve that link, whether that's go to the appointment, schedule and go to the appointment. Maybe it's a health promotion program that they're wanting or needing to get involved in. So we give them that time to be able to sign up, go through the program, and then we reconnect throughout to check on and how else we can help throughout that process. And at the end of the 3 months, we chat with them again. We complete the screening a second time to determine if any knowledge change has occurred. And then the participant is a successful completer of the program. The 5th strategy is almost a 2-part strategy. It's with no correlation between. One of them is a health promotion program. So again, with all of the 10 states, we selected a health promotion program called Living Well in the Community. And we are working with this year and last year, we worked with the Center for Independent Living in Savannah called LIFE. And the goal is to recruit and work with another Center for Independent Living in the state to implement this program to reach additional adults. So this program is more of a holistic, healthy lifestyles approach that starts with identifying kind of overall goals in an individual life. And then how can you break that down into smaller obtainable goals and work in everyday objectives to reach that long-term goal, to create that sustainability factor. If you create a goal that is super long-term and you're not seeing progress throughout the way, the sustainability of it is pretty far-fetched and unlikely to achieve. The second part of strategy 5 is our PSE, so policy systems and environmental changes. We are working with local health departments to encourage local health department employees to take the NACCHO Disability 101 training for local health departments. That is, again, a very similar disability competent care training that goes over accessible communication and what it looks like to serve an individual accessibly in that setting. And we are also this year, one PSE that we're super excited about is we're working with the national parks in Georgia to increase their accessibility, more specifically programmatically. So when you attend a national park in Georgia, for example, Kennesaw State has a museum type location, and you can go in and learn the history that is associated with Kennesaw Mountain. And some of the information that is displayed may not be in the most plain language accessible form. So we're working with them to update those things, provide additional resources that allows individuals with the disability community to appreciate and access the national parks more easily than they currently are. And then strategy 6 is more of a kind of overall just lessons learned, sharing our findings. We have a program website where all of our resources, our lessons learned kind of reports, and one-pagers that have been developed are there. They're accessible, and we encourage all to access those. So why is this work needed? 1 in 3 adults in Georgia have some type of disability, and 29% of those have, actually, that'll be the next slide. So all types of disabilities they experience profound health disparities. They're less likely than a typically developing person to, or a person without disabilities, to access preventive care, which that can be yearly or regular checkups with a physician. As I'm sure you're all aware, that not having routine healthcare can easily lead to development or progression of health conditions and more complex chronic illnesses, making it harder to know if a patient has conditions that require treatment if they don't have that preventative care. So providing the work that we're doing increases that access, increases their health outcomes. So of those 1 in 3 adults, 25% of those have an intellectual or daily living disability. So those includes categories of cognitive disability, independent living, and self-care. And then 14% of those are mobility disabilities. People with disabilities are also less likely to have access to the health education and health promotion programs. As a result, that can make existing health conditions harder to manage. So if you lack the knowledge on how to prevent or even just manage an existing condition that you have, then managing it is far more complex and more difficult. People with intellectual and developmental disabilities tend to have poorer health than people with other types of disabilities, and that ranges for a whole set of reasons. But the important thing to know is that they do have poorer health, and they also have a lack of access to the care that they need to treat those health conditions. So today we are providing with an opportunity to access this training. It is a completely free online training. There are 2 modules. The first module, like I said, is the care and screening, and the second is the accessible communication, and there are free continuing education credits associated with these trainings. So the responsive practice, care and screening, which is the first module, the learning objectives include to describe disparities in health experienced by people with disabilities. So it'll give you a little bit of a historical background and kind of data-wise what that looks like for individuals with disabilities. Recognize barriers people with disabilities face when accessing healthcare and preventive services. And that includes everything just from physical accessibility barriers all the way through to being in a room with a doctor and a doctor not using a mode of communication that is comprehensible to the patient. And then also acquiring strategies and approaches to provide disability competent and responsive care. So that's where we're going to kind of deep dive into what is the best way to serve a patient that has a disability and get them the treatment and healthcare that they deserve and need. The second module is responsive practice, accessible communication. So this one is the module 1 is about an hour, and this one is about 30 minutes. And the learning objectives for that will be presume that the patients with disabilities are competent to understand, communicate, and participate in their own care. So they are individuals like you and I, and they know their body, they know their health, and they know their feelings, what is hurting, what is painful, where they're feeling good, know better, the best that they know themselves the best. And so giving them the opportunity to communicate that is going to be the most reliable source versus maybe a caretaker or a family member and doing the communicating for them. They are able to understand and communicate, and they all have their own methods of communication, and understanding what that method is the start to great communication. So the next one is identifying and using alternative methods of communication. Verbal communication is not the only way to communicate with an individual. I may have a voice or speech disability, and my mode of communication is a communication device, maybe an iPad that has a program that I can click icons and it verbally speaks to you. Set clear and reasonable expectations for future communications. So it's that one appointment is not the only time that you're going to be communicating with this individual, making sure that there's clear, objective, identifiable notes that can be referred back to, so this patient does not have to establish credibility every time they're seen at a provider's office. So all of that is a lot of information from a really big program. But why is it important? Why should you take this training? Not only will you be gaining new skills, you're going to increase your confidence when training patients with disabilities. For most, it's a new population, and new populations, no matter what it is, can be unnerving. And the first time you do anything is maybe the fear of unknown, but through these trainings, you'll be able to increase your confidence in doing that. Exposure to disability competent care strategies that I know you didn't get in your professional training program. Dental schools are the only ones that have required competencies for patients with special healthcare needs. And so we're giving you this training and an opportunity to learn those strategies now as either a student going through medical school or a practicing physician now. Gain these strategies and be able to serve the population the best you can. Also, you are helping reduce health disparities experienced by persons with disabilities. So as I stated before, they have poor health, they lack the access, and you participating in this training and becoming aware and knowledgeable about these simple change strategies to include in your practice help work towards decreasing the disparities that they experience. The other thing is accessibility or like being accessible and using plain language is accessible to all. So even if I'm a typically developing individual and you hand me a resource that is in plain language, I'm going to be able to comprehend it and understand the content that is on the page. But if you gave an individual with a disability a non-plain language resource, there's a chance that they're not going to be able to. So making it accessible to all is using plain language, and using these strategies is great it's not just for disability population, but for everyone as well. And then the real kicker that is great for everybody, it's free education continuing credits. So it is about 1.5 if you take both trainings. If you just do care and screening, or if you just do communication, the accessible communication, you're not going to get the 1.5. But if you do both, you'll get 1.5 continuing education credits, and also be able to make a great impact in helping the disability community. So here are the QR codes for both trainings. I'm also going to put in the chat a clickable link for both trainings. Again, please take them. They're online, free, completely free, and it's self-paced, so you don't have a time limit of completing it. And if for some reason these links you lose them or you can't access them, our program website has them listed as well. And again, this is kind of the flyer with the QR codes again, and my contact information. I am more than willing to provide answers to any questions you have. If I don't have the answers, I will point you in the right direction or find the answers for you. And thank you so much for being here today. And we are just really excited about this opportunity to work in increasing the access and quality of care that individuals with disabilities in Georgia deserve to receive. And I am more than happy to answer any questions that anybody may have.
Thank you so much, Cindy,
Yeah,
for
thanks for
that
having me.
valuable information. I actually learned a lot. I didn't know that many resources was available. And I know practices are busy with their day-to-day responsibilities and is not aware of what resources are available. So it's great that you shared this information, and we'll pass it on. As Sydney stated, if you do not have access or not able to access these trainings on this webinar, you can reach out to Sydney or myself. My contact information will be at the end of this presentation, and we can provide you with these trainings and the links to be able to access. It looks like we do have a question in the chat.
So time-wise to complete both trainings, it would be no longer than an hour and a half. That would be max. I would say that an average to complete both is somewhere between 50 minutes and an hour 10.
So as to the trainings that Cindy mentioned, we also here at Highbridge offer continued education training through Format Approved. You can use the coupon code Highbridge20 to receive a 20% discount. And this presentation and this information, all this will be available on our website for you to access. We have our Highbridge webinars, monthly webinars, every third Tuesday of each month from 12 to 1 p.m. We also offer we have Highbridge e-newsletter that comes out also the third Thursday of each month, and it is a lot of valuable information and great resources in our newsletters for you, available for your practices. Again, my contact information is here at the end of this presentation. We thank you all for joining. Hold on one second. I think we have some more questions in the chat. Okay, they said thank you so much, Sydney, for this valuable and great resource, valuable information and great resources.
Yes, absolutely. Thanks so much for having me again. And again, I'm more than happy to answer questions via email if you think of any after the fact. And we're really looking forward to seeing those people take the training and make an impact in the community.
Okay, and we have Quentin Smith. There's no cost to these trainings. It's no cost to your practice. So we can send it to you. I do have your email on the registration information. So I can send this training out to you, and there's no cost. And as she mentioned, I think it takes an hour and a half to complete each of the trainings. Again, thank you all for joining. If you have any additional questions, please reach out to us. Have a great day.